Generally, surveyors have a list and they need to check it and they go. That's their job. They're not trying to like do anything else. So don't be scared. Be confident. If someone knowledgeable can sit there, that's better. If you have passed your second survey and are now waiting for your provider number, this is for you. Right now, CMS is doing validation surveys for people waiting for provider numbers. A validation survey is where they come and they double check the accreditor's survey. So with the validation surveys, this is kind of good news because it means your case is moving on and moving forward towards getting a provider number. So as long as everything goes well in this validation survey, you're on your way to the provider number. If you get a CMS walk-in, this is a happy thing. We're happy about it because that means you're on your way to your provider number. So please don't be scared. Don't get scared, get prepared. And we're going to talk about the different things that we've seen them ask. So typically with a validation survey, it can go a couple of ways. They can either ask a couple of things or they can ask a lot of things, but we're going to talk about just everything we've seen. So first and foremost, it's very important that you have somebody seated in the office. I'm going to hand it off to Kelly to kind of go into some of the paperwork that they've been asking for and things like that and what you should have in your office. So this is Kelly McCarthy, as you probably all know. And yeah, take it away.
Okay, so who is coming to the office is a CMS independent contractor. So that's where a lot of the variation comes in what they're asking for, because every person is going to ask for different items. So first and foremost, what they are confirming, just like any other uh, site verification visit from CMS, is the physical location, which is why we're talking about having somebody in the office. So with that comes your door sign, making sure that the information on it matches up to what they have. This includes your office hours, your phone number, making sure that that works. It's very important because they may call that number to verify as well or to try to reach you. And then they will take pictures as well of these items. So the door sign and the other signage in the office. I'm going to go into a little bit of more detail on that. But the other main thing that they are for sure going to be asking for is going to be your NPI number. This is your National Provider Identification Number. This is not your PTAN. You don't have your PTAN yet. This is your NPI. So this is something you get at the very, 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 very beginning before you even submit the application. So it is definitely something that you have. And they're just verbally wanting to confirm it. So you don't have to have it memorized or anything, but you just need to be able to locate it and give that.
Quick thing, the NPI number is like 9 or 10 digits. It's a very long number. So if you're not sure, it's a very long number. And it's not your state license number, which is also a very long.
So those are for sure things that they have been asking 100% of the time. Beyond that, it's been varying from surveyor to surveyor. They are obviously, like I said, double checking to see who is in the office. A lot of times they're asking who these people are, meaning what is their role in the company, what is their position. And if it is a person who's just like an office staff, it is a good idea to have an HR file for them. So that is something that if it's a new person in the office, or anything like that, making sure you do have a full HR file set up for them. The other thing they're asking or not asking for, but verifying is going to be that you have all of your doors or pardon me, your wall signs up, which includes your license, your current license. If your license is expiring before July 1st, you should have already submitted your renewal. So if you haven't, please get on that ASAP because they are taking a while to process and they might ask if you've already submitted.
If you need help with that, give us a call.
Absolutely. The other thing is making sure you have your accreditation certificate up. So with these people pending provider, you get your accreditation certificate via email. Sometimes they send you a fancy paper copy in the mail too. But either way, it doesn't matter. It doesn't have to be fancy as long as it's hung up. And then verifying that your labor law poster is current 2026. Because they obviously give me a new one every year. So just making sure that that's up to date. And then again, like I touched on before with the phone, making sure that any of your contact information is accurate to what is real contact information, working contact information.
According to your applications.
Yes.
Sorry, I need to jump back on the office signage. So besides the license, the accreditation certificate, and labor law, you also have to have your organizational chart on the wall. This is very important.
Using that.
Your map and your complaint wall sign. There are other wall signs that we provide in this process, but these are going to be absolutely critical. GSA, org chart, complaint process.
Other items that they are requesting most commonly is going to be, what is your current active census? Many people haven't taken on new patients since survey. That's okay. You then have a 0 active census. And then, you're waiting until you get your provider to actually start admitting patients.
It's totally fine
Yeah.
to not have an active patient while you are waiting for your provider number.
Regardless of how you intend to bill those patients, though, if you do have any active patients, I am telling people to make sure you are prepared to provide an active census. We don't know yet if they will ask for any charts. I have not yet had any of my my people I've spoken with have active patients, so I'm unsure yet of what they will ask for if you do have active patients.
But please keep in mind that if you passed your survey recently, those patients might still be active. So they are not necessarily asking for new admitted patients.
Another thing they're asking for commonly is your marketing materials. So again, this is another place to check and make sure any of your contact information is accurate and working. So email, phone, fax, any of those items. This is typically your trifold brochure you're going to have in the office. It could also be a business card. That's also acceptable. They have commonly asked for your admission package to be able to see that. Again, another place to make sure all the contact information is accurate and correct and working. They are often asking for a current staff list. This is who is in your office, your admin, DPCS, your designees.
If you have questions about this, give our office a call. This is a case-by-case kind of conversation, including the active patient thing, including if you don't have marketing, the trifold or a business card or something. Just let us know if, whatever the situation is. Please don't call the office saying, I don't have this or that, until you go to your office and see if you have it or not, because all of this stuff should be there.
Another thing is going to be your HR files. This could be electronic or it could be paper. Either way, you would need to be able to access them to show the surveyor. They may be asking where your patient files will be kept or are kept. Mary will into a little bit more detail on that, but basically that's your locked filing cabinet typically. They might also ask to see medical supplies that you have in the office. Might not.
It is okay to not have medical supplies in the office, but if you want to have something, you can. Basic medical supplies are gloves, normal saline, any kind of wound care supplies, hand sanitizers, things like that. What usually active companies do nowadays is whenever a patient pops up, whatever supplies they need, they will drop ship from Amazon those supplies. So you can have supplies in the office. You don't have to. If you don't, this is how essentially companies function nowadays. But you can also just have supplies in the office. One little detail about having supplies in the office, please make sure that you are checking their expirations monthly, because these things expire, and it's like also bad to have expired supplies in the office. So just be mindful of that. Um,
So just a quick recap, the main basic things that they are coming to verify that we have seen so far are going to be your door sign and that the information is accurate, NPI number, verbally confirming that with you, asking for a list of who is in the office, asking for what your current active census is, then taking pictures of the office, just like in any normal CMS site visit. So any of the additional things could or could not happen. Those have been the things I've seen in almost every single visit so far.
let's talk about the person who is sitting in the office. So there needs to be somebody during office hours who sits in the office. It's not enough for that person to be like just a warm body. So a couple of things that they need to know, have, whatever. First of all, they need an HR file. If you have somebody who sits in the office and doesn't have an HR file, please take a blank HR file, fill it out for like have them fill it out, and you guys fill it out too. And if you need help with that, please call us and we'll help you. That's number one. Number two, they need to speak English because CMS would be asking them stuff, so they need to be able to reply. That leads us to number three, which is they need to know a few things. So they don't have to be like the top expert of home health stuff, but they need to at least know, for example, who works in the company. So, like, who's your DPCS? Who's your administrator? Who are the designees? Who's the main nurse? Like, who works in the company? They also should be aware that they are employees of the agency and have an HR file and be employees of the agency. Because sometimes, we're like, for example, right, like, I don't know if you're asking, like, let's say your cousin who has the summer off from school and that's what's sitting in the agency, they're still the employee of the agency, even if they're your cousin. So, like, they should be aware that they're employees of the agency. Having them not be an employee or saying that they're not an employee of the agency, or I'm just helping out, or whatever it is, that could pretty much like cancel this whole process for you. And because of the moratorium, no longer will you be able to reapply. So we want to make sure that we don't get like silly little problems like this. They should know their title from their HR files. So if it's somebody who's like really like, right, like is involved and is going to be working in the company and stuff like that, like, I'm not too concerned about that, and whatever the title is, it's the title. But if it's someone that's like generally there to sit there during this period while you wait for your provider number, and there's not really much going on because you don't have active patients and are not going to admit active patients until that happens, then give them some very low level title, like receptionist or something, whatever, something like that, where they're not expected to know a lot of things based on that, because that's the truth, right? They're just sitting there to answer the phone or open the door if someone comes in. They should also, in the concept of knowing who the staff is, they should know who the official owners are, because um right, like, I'll give you an example. It might be a husband and wife owner team, right? But like, let's say the husband is the official owner and the wife is helping, or vice versa. So they should know like whose name is on the paperwork and things like that. So and they should be able to give a census if you have active patients, give an HR list for like the staff list and things like that. Like, they should have some just these basic concepts down, because if CMS comes and they can't even answer these basic things, then uh, this could be a problem for you. So please make sure that they are aware of these things and that they have an HR file and things like that. Also, please make sure that you have all these things on the walls, just like Kelly said, that your license is current and active and all this stuff. If it's expired, then renew it immediately. Same with ACHC or JCO or CHAPA certification. Please make sure that your office phone number, as you know it in your email and all this stuff, is the same as whatever is on your wall signs. So if you have, an office number, but like it changed at some point or whatever, that information needs to be updated with health department, Medicare, AC, whatever, all the places. So we can't change this information just like that. We have to update it. It's not a big deal to update it, but it needs to be updated if, let's say, you lost the number, now there's a new number or whatever. In that same token, please make sure that you have access to the phone and that the phone works. Sometimes we don't get phone calls on these phones for a very long time, so we assume it works, but then like let's say somehow for whatever reason it got disconnected. We had this issue 2-3 weeks ago in a enrollment accreditation survey where the person thought that their phone was working and active and it was disconnected and they ended up canceling the survey. Like, it's a small thing, but it's a big consequence for having like a non-working phone number. From CMS's perspective, they're going to say, well, how are you treating patients if the patient can't call you on the number you give them? So this is very important. Please make sure your phone works. If they are nice and they come and you're not there, they maybe might call you. So important that your phone works.
Or they maybe come back in an hour.
Right. Or they might just fail the whole application. So we just don't want to mess with it or take any chances. So let's talk about some basics you should have in your office that you had in your office probably during your survey. And for some reason, we've seen a couple of cases where it was there during survey and then it's not there. That's fine, but just make sure it's there now. First of all, a lockable filing cabinet. This is important, and your charts need to be inside of it. Then, so pretty much they can ask, are your charts paper or online? Please make sure you have a fire extinguisher. If you don't have a fire extinguisher, go to Staples. Like right after this, when you go end meeting, just go straight to Staples, buy a fire extinguisher and put it. You should have your policies and procedures. Either you have it on paper or you have it online. Very, very important. If you get a walk-in and someone's like, this is this kind of survey, this is the, please, 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 first and foremost, ask them for a business card. If they can't give you a business card, ask to see their badge. When they show you the badge, write down their name and where they are coming from. Because right now there's surveys from a few different places, and it's a very different thing if your survey is from Medicare versus the health department versus accreditor pop in, whatever. There's like 100 different people, companies, whatever, are doing the surveys right now. So it's very important that we understand where the survey is coming from. If someone walks into your office, call us immediately. We should at the very least just be aware that there's someone in there. And of course, we can help you answer any questions. When I say you, I mean the person sitting at the office should know the basics of home health, your specific company, and things like that. So when they don't, this is a big clear sign that the company's non-operational or whatever, just like something's weird. And another thing, the attitude with which you need to approach things when people come.
Yeah, so confidence goes a long way. I understand this is a scary situation. You have them coming in, literally getting your provider number and having all this time and money is riding on this whole, what could be 5-minute visit. I'm not saying not to be scared, but do your best to hide it and be confident. Like, this is why we're saying the person who is there, whoever it is, go through this stuff with them if they're not sure. Make sure that they know this because they are an employee of the agency, and so they should know this stuff. And do a practice test run. That could work, you know. But the more confident you are, the more sure you are of knowing, okay, yeah, an MPI, no problem. Here you go. Yeah, office, here you go, right here. Oh yeah, HR, here you go.
They just kind of leave you alone.
The faster it goes, the quicker they're in and out. So it's like I said, we've had people who they ask for just like a few things and they're like, okay, cool. That sounds good. Take a few pictures, go. The more we've noticed that people start being like, I'm not sure, calling 10 people, keeping them waiting. I don't know, is when they start asking for more. And then they start asking for more. And then they start asking for more. So, the easier you can get them the initial stuff that they're asking for, the less they might, it seems like it's the less they're going to ask. Yeah. Because they're just there to go down their checklist and make sure the things that they need to make sure are there and get
And
pictures.
that's it.
And
Like,
that's
get
it.
out and get out.
Yeah.
Generally, surveyors have a list and they need to check it and they go. That's their job. They're not trying to like do anything else. So don't be scared. Be confident. If someone knowledgeable can sit there, that's better. If not, one big recommendation, you may know, you may not know, we have a YouTube channel. On this YouTube channel, I am explaining everything about home health, blah, blah, blah. Just if that person's just sitting there, like literally just sitting there and has nothing to do, let them watch this YouTube channel on the computer that you bring as part of your office supplies. Because I just explain how things work. What's an episode? What's a frequency? What's a this? What's a that? They will, if they feel like you know what you're doing, they're gonna just, they want to make sure that this is an operational company, everything's normal, and they're moving on with their lives. Like, that's that. If you guys have any questions or need help, please call our office. We're not taking questions on this webinar because I'm assuming a lot of the questions are going to be like, I think I have this, I don't know if I have that, whatever, things like that. So these are for the office to
Individual case by case kind of things.
um good luck. If you successfully pass this process, we think that the next step is going to be a capitalization request. Can you explain a little bit about what that is?
Yes. So traditionally before this year, it used to be that once the provider verification kit was sent from CDPH to NGS, they would immediately do a third capitalization request. So this is when they check the money in the bank account. We have to send the, letter saying how much money and then all that. So instead, nobody has gotten that. And instead, we are getting these now site visits. So I am guessing that next people will be getting an email saying that you passed your site visit and now we need to do the third capitalization. I have not gotten anybody getting any kind of communication yet because, as Mary said before, these just started like this week. So I'm guessing within the next week or two, people are going to start getting notifications from NGS. Any email our clients get from NGS immediately forward to us so that we can, help you with whatever they are requesting. It could be a case where they're not asking for a third capitalization. I personally highly doubt that, but could be, don't know. And so it could be you just get your provider number. Not sure. But whatever it is, forward to us so that if it is a capitalization, we can help you with that or we can let you know, hey, this is provider. Great. Fantastic.
Yep. So hopefully you will finally get your provider very soon. It's been a long wait this time around. If you want to have the person sitting at your office learn about home health, let them go to YouTube at the Home Health Consultant. That's our YouTube. And yeah, that's that. So let us know if you have any questions. What's our phone number?
877-406-9727. So that's 877-406-9727. You can also visit our website, thehomehealthconsultant.com. There's a lot of good resources on there, as well, links to podcasts, there's articles. So a bunch of different resources for you and your team as well.
Yep. All right, guys. Thank you so much and good luck